Well, hey, everybody, this is Robert, and welcome to this Outbreak Newscast. And I'm going to go ahead and do a review of some of the bigger stories in the past week. And let's go ahead and start out with Mpox. This was clearly the biggest story of the week. And it actually started about 10 days ago when the CDC, the Centers for Disease Control and Prevention, issued a travel notice and a health alert network due to the clade 1b Mpox strain. This week, the Africa CDC declared a public health emergency of continental security, which was followed by the World Health Organization the next day, declaring Mpox as a public health emergency of international concern under the international health regulations. In declaring this public health emergency of international concern, World Health Organization Director General Dr. Tedros said, quote, "The emergence of the new clade of Mpox, its rapid spread in Eastern Democratic Republic of the Congo, and the reporting of cases in several neighboring countries is very worrying. On top of these outbreaks of other Mpox clades in the DRC, and other countries in Africa, it's clear that a coordinated international response is needed to stop these outbreaks and to save lives." Now, the emergence last year and the rapid spread of the new virus strain in DRC, clade 1b, and its detection in countries neighboring the DRC is especially concerning and one of the main reasons for the declaration that happened this week. And this is the second declaration relating to monkeypox in the past 2 years. You may remember back in 2022. The Africa CDC reports at least 13 African countries, including previously unaffected nations like Burundi, Kenya, Rwanda, and Uganda, having reported Mpox outbreaks. Now, so far in 2024, these countries have confirmed nearly 3,000 cases and over 500 fatalities, primarily in the Democratic Republic of the Congo. Suspected cases across the continent have surged past 17,000, a significant increase from the little more than 7,000 cases in 2022 and about 15,000 cases in 2023. Officials with the World Health Organization and the Africa CDC note that this is just the tip of the iceberg, what we're seeing. Now, the first case of clade 1b was also reported this week outside of Africa in Stockholm, Sweden. Now, the European Center for Disease Prevention and Control, or the ECDC, on Friday warned that more imported clade 1 infections are highly likely and urged countries to take preparedness steps. Now, the ECDC said due to frequent and close travel links between Europe and Africa, they recommend that member states issue travel advice for people visiting or returning from areas affected by the outbreak. Now, the likelihood of infection for people from the EU traveling to affected areas who have close contact with affected communities is high. Additionally, there is a moderate risk for close contacts of possible or confirmed imported cases into the EU. They also recommend that public health authorities in the EU maintain high levels of preparedness planning and awareness-raising activities, which may include effective surveillance, laboratory testing, epidemiological investigation, and contact tracing capacities. In some other news related to Mpox, the U.S. National Institutes of Health, or the NIH, reported this week that the antiviral drug tecovirimat did not reduce the duration of Mpox lesions among children and adults with clade 1 Mpox in the DRC, based on an initial analysis of data from a randomized placebo-controlled trial. Now, there are 2 vaccines currently in use for Mpox that are recommended by the World Health Organization. And these are approved by WHO-listed national regulatory authorities, as well as by individual countries, including Nigeria and the DRC. Now, last week, Director Tedros triggered the response for emergency use listing for Mpox vaccines, which will accelerate vaccine access for lower income countries, which have not yet issued their own national regulatory approval. The emergency use listing also enables partners, including Gavi and UNICEF, to procure vaccines for distribution. Now, monkeypox virus has two distinct genetic clades, right? Subtypes 1 and 2, which are endemic to Central and West Africa, respectively. Clade 1 monkeypox virus has been previously observed to be more transmissible and to cause a higher proportion of severe infections than Clade 2 monkeypox virus. The ongoing global monkeypox or Mpox outbreak that began in 2022 is caused by Clade 2 monkeypox virus, and cases continue to be reported worldwide. Now, outbreaks of Clade 1 monkeypox virus associated with sexual contact among men who have sex with men and female sex workers and their contacts have been reported in some provinces. In other provinces, though, patients have acquired infection through contact with infected, dead, or live wild animals, household transmission, or patient care, right, transmitted in the absence of appropriate personal protective equipment. A high proportion of cases have been reported in children younger than 15. The next big story of the week actually popped up on our radar on Friday. For the first time in a quarter century, a polio case has been reported in Gaza. Now, according to the Palestinian Ministry of Health, an unvaccinated 10-month-old child from Deir al-Balah tested positive for the disease in a Jordan lab. Quote, doctors suspected the presence of symptoms consistent with polio, the health ministry said. After conducting the necessary test in the Jordanian capital of Amman, the infection was confirmed. Now, type 2 poliovirus was detected in samples collected from the territory's wastewater back in June. Now, UN Secretary General Antonio Guterres called for pauses in the Israel-Hamas war to vaccinate hundreds of thousands of children. And I'll go ahead and take a look at what Secretary Guterres had to say about this situation.
Gaza is in a humanitarian freefall. Just when it seems the situation could not get worse for Palestinians in Gaza, the suffering grows and the world watches. In recent weeks, the polio virus has been detected in wastewater samples in Khan Yunis and Deir al-Balah. That means the virus is now circulated with hundreds of thousands of children in Gaza at risk. Polio does not care about dividing lines, and polio does not wait. Preventing and containing the spread of polio will take a massive, coordinated, and urgent effort. The United Nations is poised to launch a vital polio vaccine campaign in Gaza for more than 340,000 children under the age of 10. The World Health Organization has approved the release of 1.6 million doses of the polio vaccine. UNICEF is coordinating delivery of the vaccines and the cold chain equipment to store them. And UNRWA, the largest primary health care provider in Gaza, has medical teams ready to administer the vaccines and assist with logistics. But the challenges are grave. Health, water, and sanitation systems in Gaza have been decimated. The majority of hospitals and primary care facilities are not functional, and people are constantly on the run for safety. And routine immunizations have been severely disrupted by the conflict, increasing the spread of other preventable diseases like measles and hepatitis A. We know how an effective polio vaccination campaign must be administered. Given the wholesale devastation in Gaza, at least 95% vaccination coverage will be needed during each round of the two-round campaign to prevent polio spread and reduce its emergence. The vaccination effort will include 708 teams at hospitals and primary health care centers, many of which are barely functioning, and by 316 community outreach teams throughout Gaza. And we also know what a successful campaign will require: the facilitation of transport for vaccines and cold chain equipment at every step, the entry of polio experts in Gaza, fuel for health teams to conduct their work, reliable internet and phone services to inform communities about the campaign, an increase in the amount of cash allowed into Gaza to pay health workers, and above all, a successful polio vaccination campaign needs safety. Safety for health workers to do their jobs, safety for children and families to get to the health facilities, and safety for those health facilities to be protected from bombardment. I am appealing to all parties to provide concrete assurances right away, guaranteeing humanitarian pauses for the campaign. Let's be clear. The ultimate vaccine for polio is peace and an immediate humanitarian ceasefire. But in any case, a polio pause is a must. It is impossible to conduct a polio vaccination campaign with war raging all over. Polio goes beyond politics. It transcends all divisions. And so it is our shared obligation to come together, to mobilize not to fight people, but to fight polio, and to defeat a vicious virus that, left unchecked, would have a disastrous effect not only for Palestinian children in Gaza, but also in neighboring countries and the region. Thank you.
All right, so that was UN Secretary General Antonio Guterres discussing the polio situation in Gaza. The next big story of the week also happened on Friday when the CDC issued a Health Alert Network health advisory concerning the increase of Oropouche virus disease in the Americas region and the risk to travelers. Now, between January 1 and August 1 this year, more than 8,000 cases of Oropouche virus disease were reported, including 2 fatalities and 5 cases of vertical transmission associated with fetal death or congenital abnormalities. Countries reporting locally acquired cases include Brazil, Bolivia, Peru, Colombia, and Cuba. Travel-associated cases have been reported in Europe and in the United States. In the U.S., 11 travel-associated cases have been reported in Florida in travelers from Cuba. So far, there's been no evidence of local transmission within the United States or its territories. Now, the CDC previously issued travel notices for Oropouche in South America, but on Friday, they issued a travel notice specifically for Cuba for the first time. Officials offer the following recommendations for travelers. 1. All travelers can protect themselves from Oropouche and other vector-borne diseases like dengue, Zika, and others that are transmitted by insects by preventing insect bites, including using a EPA-registered insect repellent, wearing long-sleeve shirts and pants, and staying in places with air conditioning or that use window or door screens. One key note, and if you haven't checked out my podcast on Oropouche Q&A with Dr. Mondragon Shem, she does specifically talk about the vector of Oropouche, the main vector, the biting midge. They are so small that your typical bed nets will not prevent them from getting through. That's how tiny they are. So just something to keep in mind. Number 2, pregnant travelers should discuss travel plans, reasons for travel, steps to prevent insect bites, and potential risk with their health to their healthcare provider. Pregnant women considering travel to countries with a Oropouche virus level 2 travel health notice should reconsider non-essential travel. This sounds very much like Zika several years ago. If travel is unavoidable, pregnant travelers should follow strictly Oropouche virus prevention recommendations to prevent insect bites during travel. Travelers should be aware that the most common symptoms of Oropouche virus are fever and headache. Symptoms usually appear 3 to 10 days after being bitten by the infected midge or mosquito. Most people infected with Oropouche virus feel better within a week, but symptoms often come back. Travelers who have been in areas with Oropouche virus transmission should prevent insect bites for 3 weeks after travel. Travelers to areas with Oropouche virus transmission, including South America or the Caribbean, who develop fever, chills, headache, joint pain, or muscle pain during or within 2 weeks of travel should seek medical care and tell their healthcare provider when and where they traveled, not take aspirin or other NSAIDs like ibuprofen to reduce the risk of bleeding, and continue to prevent insect bites during the first week of illness to avoid further spread, especially in areas where mosquitoes or biting midges are active. Okay, and then the last big story of the week on this episode of Outbreak News This Week, on Tuesday, the Centers for Disease Control issued a Health Alert Network health advisory because of an increase in human Parvovirus B19 activity in the U.S. The CDC has received reports indicating increased Parvovirus B19 activity in the U.S. Data include increased test positivity for Parvovirus B19 in clinical specimens and pooled plasma from a large commercial laboratory, and reports of clusters of Parvovirus B19 associated complications among pregnant women and people with sickle cell disease. Parvovirus B19, the fifth common childhood rash that scientists named, hence the name fifth disease. Measles was first disease, scarlet fever is second disease, rubella or German measles is third disease. Fourth disease is staphylococcal scalded skin syndrome. And sixth disease is roseola, which is caused by human herpes viruses. Again, fifth disease is highly transmissible in respiratory droplets, with 50% of susceptible people infected after household exposure and 20 to 50% of susceptible students and staff infected during school outbreaks. Parvovirus B19 infection can lead to adverse health outcomes among people without pre-existing immunity who are pregnant, immunocompromised, or have chronic hemolytic disorders. During pregnancy, most cases of fetal Parvovirus B19 infection resolve spontaneously without adverse outcomes. However, the risk of adverse fetal outcome, fetal anemia, non-immune hydrop, or fetal loss is 5 to 10% and is highest when acute infection occurs between gestational weeks 9 through 20. So the CDC recommends for the public, learn more about Parvovirus B19 symptoms and who may be at higher risk of severe disease. And some of the symptoms that are common, and the main symptom that's really common is that slapped face appearance, that red slapped face appearance on the cheeks. Seek medical care if you are pregnant and have been exposed to a person with suspected or confirmed Parvovirus B19, or you have signs and symptoms of Parvovirus B19, or if you have a weakened immune system or a chronic hemolytic blood disorder, including sickle cell disease, thalassemia, and hereditary spherocytosis, and you have signs and symptoms of Parvovirus B19. Follow general respiratory precautions to prevent spread of Parvovirus B19 and other respiratory viruses. People at higher risk of severe Parvovirus B19 can consider using additional prevention strategies such as masks when around others. And know that children and adults with Parvovirus B19 are no longer contagious once the characteristic facial rash appears. Thanks for listening.